Now, can you believe that 42 million Americans have admitted to smoking cigarettes on a daily basis? The average smoker smokes about 1 pack per day, which is equivalent to 20 cigarettes. I myself used to be one of those 42 million up until recently when I've decided to quit smoking, and now I've gotten to the point where I'm comfortable enough to actually talk about it. Today I'd like to inform you of some positive health benefits of quitting smoking, some negative side effects that you may experience if you do continue to smoke, and in addition to that, some effective methods that you can use if you decide to quit. The easiest way for me to explain the positive health benefits is by laying it out for you on a timetable. Now, 20 minutes after you decide to quit smoking, your blood pressure, your pulse rate, and your body temperature begin to regulate themselves. 12 hours after you quit, your blood oxygen levels increase back to normal. 48 hours after you quit smoking, the damaged nerve endings begin to regrow, and your sense of smell and taste begin to increase. 72 hours after you quit smoking, the nicotine levels in your body are undetectable. Now, any ex-smoker will tell you the first 3 days after you quit smoking are going to be the hardest because your body is going through a chemical withdrawal. So you may experience some restlessness, some insomnia, or some irritability. After 10 days of quitting smoking, your cravings will decrease down to about 2 to 3 cravings per day. In the 2 to 3 week time frame, you've decreased your chances of heart attack and you've improved your lung functions. In the first month up until the 9th month, any smoking-related sinus congestion, fatigue, or shortness of breath have decreased significantly. And your lungs' ability to handle mucus and fight infections have also improved. 5 years down the line, your risk of stroke is the same as someone who's never actually smoked a cigarette a day in their life. For women, their chances of getting diabetes is going to be equivalent to someone who's never smoked as well. 10 years down the road, your risk of lung cancer has decreased by 30 to 50%, which is less than the average smoker, and benefits are infinite. Some of the negative side effects of continuing to smoking start with your first point of contact, which would be your mouth. Bad breath, ear, mouth, and throat cancer are all symptoms of continuing smoking. And did you know that every organ in your body is damaged in some way, shape, form, or fashion by smoking? Smoking is the leading preventable cause of death in the U.S., which is more than HIV, illegal drug use, alcohol abuse, motor vehicle accidents, and firearm accidents combined. It's also 80% cause of any type of pulmonary disease. You're increasing your risk of heart disease by 4 times if you continue to smoke. In addition to that, you're increasing your chance of having a stroke by 4 times. And finally, you're increasing your chance of lung cancer by 25 times the normal rate. Some people may say, well, health is not that important to everyone, and I can understand that as well. So a different aspect to look at smoking could be a negative side effect it has on you financially. A pack of cigarettes costs about $6 per day. So if you were to do some quick arithmetic, that's going to be an average of about $40 to $42 per week. In a month's time, you're going to spend $160 on cigarettes. And over the course of the year, you'll spend anywhere between $1,900 and $2,000. $2,000 is enough to take your family on a nice vacation. In 10 years' time, you would have spent about $20,000 on cigarettes. You could have put your child through college. You could have also purchased a car in cash. My point is, there are definitely things to consider when you're choosing to smoke or when choosing not to smoke. You've got to consider the positive benefits as well as the negative side effects and make an informed and educated decision. I hope today the information that I provided for you will be helpful in you choosing to make that decision. And if you need more information, you can always visit smokefree.gov. Thank you.